Hi, my name is Marika Steenstra-Church. Today I'll be talking about my capstone project and poster presentation. The title is Going Home and Staying Home, Successful Patient-Centered Discharge Planning from the Post-Acute Care Setting. Currently, I'm employed as the primary OT at a local rural critical access care hospital. This capstone project was initiated in response to a need expressed by the hospital administration. The identified needs and concerns by the hospital were improved interdepartmental communication related to patient care between the rehab and nursing departments, increased patient-centered care coordination, enhanced quality outcomes. Overall, the primary objective was to develop a program that enhanced the hospital's healthcare service delivery model, transitioning from a long-term care approach to a post-acute care rehabilitation mindset with a focus on measuring outcomes and improving the quality of care. This program was initiated in May of 2024. This capstone program aims to be a high-quality, patient-centered, top-rated rehab program for the post-acute care patients, which consists of clients that are 65 and older. Goals of the capstone are improved patient-centered discharge planning processes and patient-centered care, enhanced rehab outcomes as reflected in reduced 30-day hospital readmissions. When we speak about hospital readmissions, this relates to admissions from home within 30 days of discharge from the post-acute care setting and or unscheduled medical interventions or surgical procedures at the hospital that were not related to the original admission. Increase patients' functional independence in meaningful occupations is another goal of this project, and supporting smooth community transitions of post-acute care patients. The literature review revealed that we were implementing a lot of the recommended services and processes for a successful post-acute care rehab program and discharge processes to the community. This includes some of the following processes. Number one would be a multidisciplinary care conference on admission and before discharge with the team to discuss the patient's current functional levels, goals, and concern to form a holistic care plan and a safe discharge plan with the provision of necessary support services as indicated in the home. Number two, recommend home health therapy to facilitate and improve the continuum of care after discharge. A home assessment as indicated prior to facility discharge, so home modifications can be implemented and durable medical equipment can be purchased and installed. Training of the patient's primary caregivers on specific details as they relate to the daily care of their loved one. This can include wound care, medication management, fall prevention strategies, and safe transfers. And finally, tracking quality outcome measures related to the therapy in the form of a questionnaire. So overall, the purpose of this project is to achieve a more streamlined and inclusive discharge process that establishes a clear, consistent structure within the care framework, promoting the patient's agency and empowerment in their healthcare choices. The research supports that patient-centered care leads to better health outcomes. The literature review also provided insight into my PICO question. Does patient-centered discharge planning of subacute rehab patients impact hospital readmission rates? Understanding how to reduce avoidable readmissions can lead to improved healthcare outcomes, enhanced patient safety, and better quality healthcare systems. So part of the data collection was qualitative and based on an exit questionnaire with a 5-point Likert satisfaction scale. The questions were based on patient-centered care, for example, by talking about inclusivity in the goal-setting process, themes of clear communication, and patient preparedness for discharge home. Our feedback was overall positive, and patients felt supported and ready for discharge home. Some of the emerging themes from the data was that some patients did not feel included in the goal-setting process at times. Most patients felt that there was a strong health communication with clear and accessible information. And there was also an increased awareness of the timeliness of interdisciplinary discharge planning to address social and environmental barriers prior to discharge. The quantitative data reflected the total number of post-acute care patients admitted between June of 2024 and July of 2025. The total number of patients discharged, where they were discharged, and also we tracked 30-day hospital readmissions. You can see this in the chart on the poster. The data number for the post-acute care rehab program were as follows. The readmission rate is 4.95% as opposed to the national average of 19.6% as reported by CMS in 2023. Patient self-care and mobility, also called GG ratings, are standardized quality measures reported by CMS. The national average for the GG ratings was 52%, and our rating at the hospital was 81%. So in this case, having a higher number is a good thing. The project lasted 12 months, starting in June 2024, and continues to date, during which time data is collected. Monthly meetings with the interdisciplinary team are conducted to implement changes and adjustments as indicated. The ongoing goal is to refine processes to maximize the quality of care and ensure that discharge planning is as client-centered, efficacious, and as outcome-driven as possible. We use the POP model because it provides a strong foundation for developing patient-centered care processes in the post-acute care setting, as it emphasizes the dynamic interaction of the person, environment, occupation, and performance factors in shaping outcomes. The POP model is a top-down approach that promotes the collaborative processes between the therapist and client in establishing treatment goals. The rehabilitative frame of reference is suitable for the post-acute care setting to optimize environmental modifications and compensation principles. The literature review confirms the central role of occupational therapists and what the role they play within the interdisciplinary team for effective discharge planning. Research has shown that effective discharge planning and rehabilitation grounded in patient-centered approaches can significantly improve long-term outcomes and facilitate better care transitions and minimize hospital readmissions. So this patient-centered quality improvement project is grounded in evidence-based practice and research designed to enhance patient-centered care for patients engaged in post-acute care rehab to promote high-quality outcomes. As evidence in the statistical data presented, the data affirms the effectiveness of this program and its value for implementation. References are provided in the bottom of the poster, and I hope you enjoyed this presentation. Thank you so much for listening.